Get ready to invest in yourself and elevate your expertise with the Perio School podcast, brought to you by Perio School. It's Dr. Reena here, and you're joining us for a new monthly show where we'll be providing the latest case studies, first-hand insights, and interviews with our global dental network. Plus, we'll enable you to experience exclusive behind-the-scenes highlights straight from our global portfolio of courses. Let's get started. This season of the podcast is sponsored by Kiroku, an AI assistant built specifically for dental professionals and one we've used for years. Kiroku listens to your appointments and turns chairside conversations into accurate clinical notes, referral letters, and treatment plans in minutes. What used to take hours now happens straight after the appointment. No late evenings catching up on notes. You can start a free trial at trykiroku.com. And if you'd like exclusive discounted access, email us at hello@perio.school. In today's masterclass, we're going to be talking about Perio-Ortho, and this particular relationship has become very important, especially over the last few years with lots of ortho taking place in adult patients. So I would say this relationship is a symbiotic relationship. Ortho helps Perio and Perio can help Ortho. How? So ortho can help perio because of the aesthetics. Obviously, our perio patients end up with drifted, flared teeth with an elongated appearance. So definitely ortho can help with this. And often, actually, our patients don't come in for better looking gums. They come in for a better smile. So this is a great way of almost rewarding them once the periodontal condition is stable. Ortho also helps perio from the hygiene perspective. So crowding is clearly a risk factor for periodontitis. And more, actually, I'm now saying to our adult patients, orthodontics might be a good idea purely from a hygiene point of view and a maintenance point of view. Also, with tooth migration, it can be pathological tooth migration that can only get worse with time, that can cause functional disturbance. So also, orthodontics will help with the functional point of view. If they've got a better occlusion, that's only going to help. In terms of the other way around and perio helping ortho, well, the first thing is we need to get that stability. If you don't have periodontal stability, your ortho is not going to work, or it's not going to be as successful. At least you may even lose teeth in the process. And perhaps the ortho might not even last either. So it's from the maintenance point of view as well. But also, we forget perio can provide other types of treatments as well. It's not just periodontitis treatment. Periodontists actually do gum recession surgery, crown lengthening surgery, and all of these things actually will help with your orthodontic patients. The gum recession surgery, I'm sure you're seeing lots of recession post-ortho. The good news is often this is treatable, and crown lengthening surgery is a great way to finish your cases when the gum line and the aesthetics isn't quite as you want it. So that's the symbiotic relationship between perio and ortho. Now, when we're thinking about what determines success, if I had to narrow it down to three things, I would say the 3 P's for success for our perio patients having ortho is plaque control. It's got to be optimal. They've got to be engaged. The second thing is achieving periodontal endpoints. So you have to achieve that stability before you actually do orthodontic treatment. And the third thing is personalized. It's all about personalized care. Whether that's perio or ortho, that's absolutely key. So one of the things, I think the most important thing with Perio-Ortho is timing. And over the last few years, I have seen so many cases, and I would probably average it to once a week in our clinic, where orthodontic treatment has been done in a patient where it clearly shouldn't have, like the severe perio. They're just not a suitable case at present. And it's really sad to speak to those patients and they say things like, I wish I never had the ortho, and I have to tell them they now have to lose teeth, and it's just a total mess. So don't rush these cases. Get the periodontal condition sorted first. Now, I understand patients are pressuring us to do this kind of treatment, but build it into your orthodontic plan. Actually call the perio treatment the pre-orthodontic preparatory phase. It's all about communication. If you build it into their ortho plan, like this is the first step of your plan, they seem to be fine with it because you're not saying to them you can never have orthodontic treatment. You're building it in. So you can also plan your orthodontic treatment in the S3 guidelines. It says you can plan things, you can show them the scans, you can use that as a carrot, but your actual execution of your orthodontic therapy needs to be once they're stable during your supportive periodontal care. So what are we trying to achieve in terms of periodontal stability? Well, the ideal checklist is probing depths of 4 millimeters or less with minimal bleeding on probing, comprehensive radiographs showing adequate bone levels, optimal plaque levels, engaged, compliant patients, evidence of that stability. So all of these things, ideally, you want to fulfill that criteria before embarking on orthodontics. And I think if you're ever unsure, it's always good to get an opinion of a periodontal specialist to give you that green light or guide you if that's not the case. Now, when you're assessing your patients in practice, obviously you're looking for that stability, but also some of the other things to look out for is the phenotype. Watch out for the thin phenotypes. That's where the probe is shining through the gingivae. You need to be thinking about, gosh, they might get recession. It may get worse. Have I consented for that? So look out for that. Out for mobility. Look out for furcation involvement. But scanning can be really helpful as part of your assessments. And with the new tools that are out there, the oral health assessment suite, all of those things, scanning can really help you to assess these patients better and also to educate them as well. So we've talked about the relationship between Perio-Ortho. We talked about timing and assessment. Another factor when it comes to Perio-Ortho is grafting and soft tissue grafting. And I always get asked, do I need to graft beforehand or after? Well, there is no right answer. It really depends on the quality of the tissue that we're looking at, the severity of the recession, the direction of the movement. So if I've got really thin, unattached tissue, the recession is significant, and I'm going to be moving those lower incisors buccally, then I probably want to be a little bit careful. I probably want to pre-graft those cases. I have to say, in our practice at RW Perio, we probably pre-graft about 20-30% of the cases, and the others will be post-grafting. But if I do pre-graft, I always consent the patient that they might need post-grafting as well. So that's soft tissues. The other consideration for Perio-Ortho is biomechanics. And I think it's important to remember that we're dealing with a different setup here for perio patients. Because of the bone loss, the center of rotation is displaced more apically. So there will be a larger rotational component. So you're going to get more tipping and more extrusion, which you need to take into account when you're doing the movement. Also, the stress-strain distribution is uneven when tipping occurs, and so it's more concentrated at the coronal and apical level. So we do often see more resorption and root resorption in these cases. So you just need to be a little bit careful with that. The other consideration is biomechanics, so whether we have fixed or removable. And actually, there is no real right answer for do I do fixed or aligners. So aligners are great because obviously they're better in terms of aesthetics. They're probably easier to maintain when it comes to oral hygiene. They also allow individualized segment control of movement and control of velocity. So there are lots of advantages of aligners. Fixed, maybe it's more predictable for some movements, especially if you're doing intrusion, maybe you have better control. And the insertion forces, obviously with aligners, you get insertion forces when you're putting them in and out. You don't get that so much with your fixed. So perhaps it's more comfortable for the patient because they're obviously not taking it in and out. But it really is clinician dependent and patient dependent. So this is a discussion between the team essentially. The other final consideration I would say for these patients is to think about maintenance and retention. So all perio patients, we would advise dual retention, so both fixed and removable retention. That's the most predictable form of retention. Just be a little bit careful to watch out for wire syndrome, though, with the fixed retainers. And actually in practice, I'm seeing a lot more of this wire syndrome, and it's something to read about, and it's essentially unwanted tooth movement. And it's caused by the retainer suddenly becoming active, and you see like a localized recession defect. But basically, maintenance is key from an orthodontic point of view and from a perio point of view, because you don't want the perio to relapse, but you also don't want the ortho to relapse, because if it relapses, you're going to have to do another round of ortho, and every round of ortho adds a risk. So it's just something to think about. So yeah, that's our Perio-Ortho whistle-stop tour, the considerations to think about when it comes to timings, assessment, when you're looking at other variables, when you're assessing things, when you're using scans, thinking about soft tissue, biomechanics. But at the end of the day, if you're ever unsure, I think the safest option is involve either a specialist perio or specialist ortho to get a second opinion. You can never go wrong with that. But I hope that's helpful.
Hi everyone, welcome to Perio School Podcast. This is the part where we are discussing case studies, and my name is Dr. Sofiya. I'm Perio School Director, and today I'm super lucky to be joined by Dr. Vanessa Venchard, who has recently completed her specialist training at Eastman Dental Institute. So she has a very juicy and nice case for us to discuss, and so Vanessa, tell us about the case and what made this case stand out or just worth discussing.
Yeah, so this is a patient I managed over quite a long period of time, and it really stood out to me because it just showed me how time, consistency, and a patient-centered approach can really benefit the patient. So she initially presented taking amlodipine for hypertension with generalized inflamed gingiva, consistent with drug-induced gingival enlargement on a background of advanced periodontal disease. And she also had significant pathological tooth migration, which you could also describe as essentially movement and drifting of the teeth due to loss of periodontal support and affecting the anterior segment. There was a few key challenges with her. First of all, she was really anxious. She found it really difficult to clean because her teeth were so mobile, so she was really anxious about that. So her oral hygiene really needed a lot of support. Also, that hypertensive medication she was on, it had taken her quite a while to stabilize her hypertension, so she really didn't want to change her medication. So we had to manage the gingival enlargement without the medication change. And finally, the pathological tooth migration. So that was due to quite a number of factors, such as bone loss, her open bite, and a tongue thrusting habit. And so that made the overall prognosis quite poor. So that was also quite complex to manage.
Wow, that sounds like a really challenging case. I mean, dealing with anxious patients is not easy. It's another skill. But on top of that, you got amlodipine and also a pathological tooth migration. Wow, that is a really interesting case. So how did you approach the treatment planning for this patient?
So the key decision early on was to focus on stabilization rather than trying to correct the tooth position. So we prioritized non-surgical periodontal therapy with an intensive oral hygiene instruction. We decided to monitor the pathological tooth migration using an intraoral scanner so we could objectively track changes over time. We also had to really early on have a conversation with her that the teeth could drift further during treatment and offered her a removable retainer to help stabilize things. But equally, I did explain to her that once you get inflammation under control, sometimes you actually can see a natural improvement in the position of the teeth, which is exactly what we were hoping for. So the plan was very much stabilize first, reassess, and then consider any further intervention.
Really interesting. So many considerations you need to take into account, but also patient communication, managing expectations. So how did this patient respond to initial therapy?
She responded really well. I saw a significant reduction in the inflammation and improvement in the tissue quality despite no change in her medication. And interestingly, we also saw some spontaneous improvement in the position of the upper left canine as inflammation resolved. So it was very proclined and it retroclined slightly as well, which we were able to monitor from the scans. And that was really positive and really encouraged the patient to continue maintaining what she'd already achieved.
Yeah, that sounds really, really positive. I'm sure the patient was very happy with the result, but was there any other stage or next stage of treatment?
Yeah, so following the initial non-surgical therapy, even though we were able to get a really good result, there was still some further periodontal stabilization that was needed. So I did some more advanced treatment. So I did some targeted periodontal regenerative surgery. I used a combination of xenograft material, enamel matrix derivatives, and resorbable membranes to try and regenerate some vertical defects and furcations. There were some sites which were quite challenging. There was an upper molar that had a grade 2 furcation and a premolar site with an anatomical groove. Both got really good results, and it would have been really difficult to maintain those sites without surgical intervention. So was really happy with the result from that. Once we managed to stabilize all of the gum disease, she was then referred on to a restorative dentist to manage the aesthetics. So happy with the case, really good outcome, and the patient was really happy at the end.
Well, yeah, definitely a very complex case, and the way you approached it, and then the multidisciplinary approach, and also the fact that she didn't have to change any medication, that is very impressive. So, very well done. I'm sure this is like a huge learning point for younger dentists or anyone who's interested in perio. So, for you, what are the key learning points from this case? What did you learn? Is there anything you would do differently, or just tell us what would you recommend to dentists to do if they are having cases similar to this?
I think the key takeaway is that even though there was so many things going on with this patient, especially as a young dentist, you may, panic and think, oh, there's so much going on, and get quite bogged down in the details. I think it's important to just go back to the stages of periodontal therapy and follow the steps, and just start with the non-surgical and oral hygiene and risk factor control, because once inflammation is controlled, you can significantly change the clinical picture, and then you can do more targeted advanced treatment.
So as you've told us already, there were so many different stages of treatment in this case. So there was a non-surgical treatment, then you approached it with a surgical perio treatment. So throughout this case, was there anything that made you improve in terms of how you practice, or to change anything in your practice, or how you would approach patients?
I think I took most from this case was the importance of listening to the patient and working with them. She was so anxious about a number of things, and one of them was the fact that she didn't want to change her medication. So I worked with her to achieve that. I think a lot of other patients, maybe in the past, I've gone straight into changing the medication, and this case just showed that you don't always need to change the medication if you can get everything under control without it.
Yeah, I think working with the patient is so important, because they need to understand that perio is a team approach. It's not just specialists, not just hygienists who are treating it. It's a team approach, because patients need to understand that they are in control as well, and managing the case altogether, possibly involving other specialists, is probably the key to success. Thank you, Vanessa. That was really, really interesting. I hope you enjoyed this case discussion, and please stay tuned for further episodes. Hi everyone, Dr. Sofiya here. As you know, Perio School went to Sydney for the hands-on part in diploma, and we have just finished our 3-day intensive hands-on, and we just wanted to talk to our delegates and ask them about their experience, their feedback, and you're just about to hear testimonials from our delegates who did hybrid international diploma in periodontics.
So my name is Agustia. I'm a dental hygienist in Adelaide. So I graduated a couple of years ago from TAFE, and I have a special interest in periodontal health. That's something that I'm quite passionate about. So when I heard about this course, this is something that I really looked forward to. I think the way that the course is structured is quite nice. It fits quite well with my work-life balance, especially with the webinars and Reena being quite accommodating to the timings of the Australian people. I think that worked out quite well. And it's good that the videos are quite short and comprehensive at the same time, so that added value to the time as well. It's been good so far. Yeah, no, the 3 days have been really good. Yeah, they're very proactive and practical. Most of the theory was covered in the online lectures anyway, so it's good that during these 3 days we're focusing on the hands-on aspects of the training, so it's been really good so far.
What's been your favorite hands-on?
My favorite hands-on was the airflow and the hand instrumentation. So sometimes I struggle with certain areas in the mouth, and it's just really good to have someone like Reena and Sofiya there to approach them and ask them how do they handle it. And I've found a lot of answers to my questions. Yeah, this course has massively helped with my communication techniques and how I explain their gum conditions to the patients. I feel like they trust me more and they have more confidence in me, and it's really helped my confidence as well. My treatment plan acceptance rate has increased quite significantly, so it really does make a difference overall. And yeah, I'm starting to get good treatment outcomes with my treatments as well, so the course is really helping so far.
My name is Maria. I'm originally from Argentina, being an OHT in Auckland, New Zealand. And yes, loving the hygiene part of what I'm doing. And what I'm doing here, I saw the course through Reena's Instagram, and then I was so happy that you guys were coming here, and I said, yeah, let's do it. I think this part was just a highlight of the whole hybrid learning. I think it just kind of like got all the knowledge that we learned through this month together, just having the practical session and just having the one-on-one session to check anything that we need to deepen our knowledge or where we wanted to grow a little bit more. But yes, I'm loving this part as well. We have done some hands-on training on airflow yesterday, and then the piece-on practice, and then Reena coming and checking on us and just telling me, hey, you need to improve the technique here instead of going wider strokes, just focus more on certain areas. Having her checking on my work, yeah, invaluable. Yeah, pretty good. So yeah, basically even at uni, you don't usually have that because we're so many. So yes, poor clinical educators, they don't have the time to, go one by one. So having this option and opportunity, yes, 100%. So yes, I will 100% recommend doing this diploma. It has given me much confidence and improved skills while treating the patients. And you can actually see it on the patient's feedback. So 100%, it's a yes for me.
I'm Emma Wallace, and I'm an OHT from Adelaide. I currently work in a periodontal practice, and I really wanted to improve on my practice and learn a bit more about what happens elsewhere besides here as well. So and the latest information too, yeah. And also coming here, it's actually been more like hands-on, meeting everybody, and everybody's in the same boat. They're all beautiful people, and I just find that we are able to actually, I guess, meet the person behind all of this, which is really very great and personable. I think that the information presented is it's very well, once again, very clear. It's like straight from the videos, in that she's standing up there, she's giving the information, and we can ask questions anytime. There's no, look, we've got the time, It's actually like just in a very good flow, and it's, very professional, which is fantastic. I don't work with airflow, and I found that system was actually really easy to use. It has the combination of the airflow and the piezo, and just the clinic sizes. It's perfect just for the group size that we have. So it means that we can all sort of see, and we can all ask questions, and we can all hear what she's saying, and we can visualize everything that she's doing. I don't know. I found it just very, very, very good.
So in this episode of the Perio School podcast, in our dentistry section, we have someone very influential in the Australian market. And every episode, we like to interview people from across the globe and see how things differ, in different continents, both in terms of the dentistry, but also just to get a behind the scenes of how people work. So today we have Suzie with us. She is a dental hygienist, OHT based in Australia. So Suzie, actually tell us a little bit more about yourself.
Hi everyone, I'm Suzie. I've been a dental hygienist for over 20 years now.
Wow.
My career started way back when I was 16. I was a dental nurse, and I did that for many, many, many years. And then when I was 21, I traveled to London and I worked over there for 2 years, and I met a dental hygienist there. And I was like, whoa, this is really cool. I really want to be a dental hygienist. So I researched it, and the guy I was working for over there, he was like going to sponsor me to stay over there to study, but things happened in Australia. So I came back, I studied. They didn't have the course here at that stage in Sydney. So I did a dental therapy course, and then I applied at Melbourne University and did my hygiene stream there for 12 months. And then I came back, and I've been practicing hygiene ever since. And I predominantly practice perio, which is my passion. And just maintenance and taking care of patients out of perio conditions and so forth. So
Yeah,
that's
amazing.
pretty much me.
And yeah, we met last year when we did a Perio masterclass in Sydney. And I was so impressed with everything you were doing and your Facebook group and how you've really built such a supportive community out there. And of course, this year you're doing our diploma as well, which is, yeah, it's been amazing to see you twice and see all the things you're doing. So, yeah.
Yeah.
So tell us more about hygiene, working as a hygienist in Australia, like for people in the UK, especially, and you've kind of experienced, you've seen both worlds at least. Is it quite different? Like what kind of things, just to give us an idea, do you do day to day in your appointments? How long are your appointments? All those kind of things.
So it was quite a while back when I saw a dental hygienist in London. She was basically just doing basic routine cleans in NHS.
Yeah.
So I didn't get to experience the whole periodontal side of it, but I did get to experience the whole taking on the patient, motivation, cleaning their teeth. And that to me was really exciting because I needed to progress at some stage. Um, so yeah, it is very different in Australia in comparison, especially after speaking to you and learning a lot from you. And especially I have quite a few friends in London or the UK base who are hygienists, and the comparisons are huge, like with local anesthetic. I have a dental hygienist friend over there who does injectables, whereas we cannot go anywhere near injectables here. Um, so the commitments we have here in regards to what we can do clinically, I feel like it's a lot more advanced here in Australia
Yes.
with X-rays and diagnosis and treatment planning and so forth. I feel like the hygienists here take on a much bigger role here than the hygienist, I'm assuming, just from speaking to
Yeah.
yourself.
Definitely. I mean, when I and I say this to everyone, when I came the first time and now the second time, it's just reinforced it. I was so impressed, like with all of the hygienists out there, like the amount you do in your appointments. You literally do full mouth, when it's a generalized perio case, full mouth PAs, photographs, pocket charts, treatment planning, diagnosis. You're working to such a high level. It's so inspiring,
Yeah.
and it's intense. But the thing I like about Australia is I feel people have got that balance and quality of life correct. So you work really hard, you finish at a decent time, but then you really recharge and you've got the beauty of the great weather, the outdoors there. So it's such a great, and I mean, I would move to Australia any day. I nearly did actually, but because of family, I didn't end up doing it. But I think it's, for people thinking about it, I think it's such a great place for dental professionals.
Yeah. Hygiene's changed a lot over the many years that I have practiced hygiene. When I initially graduated as a hygienist, there wasn't a lot of hygienists here in Sydney. I'm talking predominantly Sydney based, because there was no course here in Sydney. So my skills were wanted. And then a course started in Sydney and it became popular. So hygiene has changed a lot. And a lot of people have fought really hard to maintain the level in which we practice here, because then the dentists were upset that the hygienists were doing things and they were saying that we were possibly doing things that we shouldn't be doing. But in actual fact, we were pretty well educated, and the education around hygiene here in Australia, I'm talking mostly Sydney, is still, they're still learning, and I'm
Yeah.
blessed enough to be working in a practice where I work in a really good team where my boss and I work really good, and he trusts me, and I do the foundations, he takes care of the house kind of thing. So it takes a while to get there. So
Yeah. No, for sure. And I think, yeah, it's been great to see then with the diploma, all of the things you're all implementing in the confidence level. And I
yes,
feel like just actually generally with hygienists, there is such a thirst for knowledge, which is
yeah,
fantastic. So,
yeah,
yeah.
such
Well,
a
thank
thirst. And in regards to, sorry, going back to the diploma,
Yeah.
um, see, because I've been in hygiene for so long, I've done so many courses. I've done hundreds of little courses just to keep my CPDs up as well as learn. But there's only
Yeah.
so much you can do. And when I met you last year and I did the 1 day course with you, the Perio Skills one, I was like, oh my God, this is exactly where I want to go. This is exactly what I want to learn. And so when I saw that you were doing this whole postgrad diploma thing, I was like, okay, here we go. We're diving in. It's been amazing. So, and it's changed me clinically so much. Like,
That's so great to hear. And I also think like it's important to never stop learning. And I think, you know,
no.
you're a living example of that. It just keeps things interesting. It keeps you motivated. So I have some quick like questions for you because we always like to, people we interview, we like to know a little bit more about them and some interesting questions. So I'm going to do some quick fire questions. So I'll start off with how do you start your day? What are some non-negotiables in the morning?
Okay. So when I wake up in the morning, the first thing I think is, okay, I'm grateful that I'm awake, first and foremost.
Yeah.
So my days are usually pretty the same from Monday to Thursday. I wake up around 6 o'clock. I go and I get my dog and I go outside. So that's my usual routine. And then I come back and it's just get ready for the day of dentistry and teeth. And then Friday through to Monday, again, very different. I wake up really early still, but these are my days. So they're my gym days. They're my days where I center myself, I decompress from the busy, crazy week, and I study. I do your diploma.
Oh, well, yeah, and just a few months left now, and then you'll have some extra free time.
I know,
I think
right?
the point is actually that balance of, and I always say to everyone on our courses, you don't want to be working 5 days. It's too much for what we do.
Yeah.
Yeah, completely agree. So what's something that's always stocked in your fridge?
A pineapple juice.
Ah, very nice.
I crave it. It's not an everyday thing, but it's always stocked in my fridge. It must be the vitamin C in it. I don't know what it
Yeah,
is.
possibly. And what is one item that you couldn't live without, like day to day, something that you use, whether you're working or at home? What's like something you can't live without?
Okay, so at work, it's my airflow unit.
Okay, yes.
So yeah, 100% my airflow unit. I refuse to go to work if my airflow unit's not working. And generally, day-to-day life is my water bottle. It goes everywhere with me.
Yeah, great answers. And what's your go-to lunch? Like if you're in a rush when you're on clinics, do you
Yeah.
have like I'm guessing you have a lunch break. I know some people don't. What keeps you fueled? What keeps you because your energy is always so high. What's the secret?
Oh, so not always high. Um, so um, if I'm in a rush and I need a quick go-to, it's always a quick protein smoothie.
Right.
I'm at an age now where I just need to keep my energy up, and it's always something that's going to sustain me. So I'm known for my quick. I'm in a rush. Protein smoothie, and off I go.
And then yeah, that's the thing when we're back to back with patients or then overrunning, like it's so easy just to skip lunch. So yeah, protein
Yeah.
smoothie is such an easy thing to bring in. Interesting one. If you could swap lives with anyone for a day, who would it be?
Okay, I love this one. So I couldn't think of anyone like in regards to human being I would change my life with, but
Yeah.
then I thought about it and I was like, I would change lives with my dog for 1 day
I love it.
because she's so spoiled. You know what I
What breed is she?
mean? She's a little staffy and a little English
Oh,
staffy.
so cute.
Yeah. So she's
um,
spoiled rotten. So I was like, I would change my life with her for 1 day.
Amazing. I have two more questions. Okay, what would be your dream holiday destination? Now, I know obviously you're in such a beautiful part of the world, but for you, where would your kind of dream holiday be?
Yeah, I'm a water person.
Mhm.
So I am on my list is the Maldives.
Yes, and not too far from you either.
Nah, nah. I really want to go there 1 day. So it's definitely on a bucket list for me.
And my final question is, do you have a favorite quote or a personal motto that you live by?
Yeah, I'm known for these. I'm always saying to my daughter, follow your gut instinct.
Mhm.
I think that's probably the one I use the most, because I think we're blessed to be able to have gut instinct, and when we use it and we use it correctly, it works really well. So
I
I'd probably,
couldn't agree more. Anytime I'm confused with something, you know, you get that feeling, and it's crazy how it works. It's just that intuition, but it's always right. And when I go against it, it
yeah.
always ends up being a mess. And I'm like, oh, I wish I listened.
Yeah, you're
Susie,
right.
I know you're super busy. Thank you so much for giving us an insight into your world, and keep doing what you're doing. You're so inspiring. Where can our listeners find you? What's your Instagram, or where would be the best place to connect with you?
Okay, so I started my hygienist page, dental hygienist moving forward, on Facebook about 10 years ago.
Yeah.
So you can find me on that hygienist page. Otherwise, my little personal Instagram page that I started, it's just Suze the Hygienist. Yeah, so they're the places you can find me. But for information and share and love, go to the Facebook hygienist page.
Perfect. Thank you so much, and enjoy the rest of your evening. Take care.
Thank
Bye.
you. Bye, Reena.
This season of the podcast is sponsored by Kiroku, an AI assistant built specifically for dental professionals and one we've used for years. Kiroku listens to your appointments and turns chairside conversations into accurate clinical notes, referral letters, and treatment plans in minutes. What used to take hours now happens straight after the appointment. No late evenings catching up on notes. You can start a free trial at trykiroku.com. And if you'd like exclusive discounted access, email us at hello@perio.school.